Okay, we're going to go ahead and move to chapter 2. There's not many slides on here. There's about 12 slides. So we're just going to kind of talk about what the trends of where things are going, family-centered, community-based maternal pediatric nursing. The hospital-based is, so costly that we're moving a lot of things to the community like we talked about in the last chapter. So that's kind of where we're going to take off, kind of define family, where family goes, and how that integrates into maternal nursing. So that's kind of what we're going to do. If I can get my slides to move. Oh, maybe. Okay, so family-centered nursing, it kind of goes into pediatrics too, but each person inside a family is a member of that family or that social group. If you think about it, families have been around forever and ever and ever. It's the most basic social unit that we have. The primary purpose is to ensure survival of your unit. When you have your family, you do everything to make sure that they're going to survive outside. You care for them, you take care of them, you do all the things that you need to do. And then those families make up a whole larger social group, maybe schools, churches, social groups, school sports, school youth groups, all the different kind of social groups that you can make up that makes different things. There are certain contexts within a family and community that we kind of think that are fairly critical, and we're kind of going to go into those a little bit. But that basic social unit of where someone is at, basically when a child is born into a family, the goal of that family is to teach the knowledge that they have, their customs that they have, their values, their beliefs, and integrate them into their culture. So that family structures, sometimes those roles change. Maybe mom and dad gets a divorce. Maybe a child moves out. Maybe a death of a family member. There's lots of different kinds of things that can change that social unit, and we have to kind of adjust to how that changes. So there are basically 5 things that we want to look at as far as family function. So when you think about a family, what do you think the goals inside a family are? Or what do you think a family should instill into their members? One is just physical sustenance. What that means is you're going to provide Maslow's hierarchy of needs, the first layer. Food, shelter, water, the basic necessities. So that's the physical substance. So you're going to give them the basic necessities to live. Then you go to that emotional support. So, the children are going to form attachments inside that family. The mom-baby bond, mother-father bond, mother-significant other, child and grandparents. All those bonds are going to be made through that socialization in that family and that emotional support. And a lot of times this kind of goes along with imitation. So kids will watch other people in the family, how they interact, how they talk, how they do certain things, and they will imitate what they're going to do. And they kind of figure out real early on, what can I do that I can get by with, and what can I do that I can't get by with. And so that's that emotional support. They kind of understand where they are in that social unit, and they learn by watching what everybody does. How everybody says, do what I say, not as I do. But people inside that social unit are going to do what you do because that's what they do. They imitate behavior of family members, and they quickly learn how to adapt to certain things. And then intellectual stimulation. Every child needs intellectual stimulation. Reading them books, getting them, certain toys that can interact with them. You see children all the time who are born in families that have lack of stimulation, and those kids grow up to be very socially inept at being able to communicate. So socialization is very, very important to fit into the society, to fit into cultures, to fit into, they got to learn their role. What is my role going to be in society? Children are born, and they're born into this family unit. Then they have to decide where they're going to go from there. And a lot of that has to do with that intellectual building inside there to do that. And then socialization. How do they socialize? Who are they socializing with? Who are they imitating? What are they doing? Who are they hanging with? All of that kind of thing. And then spirituality doesn't just necessarily have to be religion. It could be maybe a family that's very big in the arts or the sciences, and that's where the theater, that's where they find their spirituality through there, and that's something that's very important to that family unit. And so maybe that's what their spirituality is. So they find a focus in their family. And so all 5 of these things need to kind of come to play to help give that family that function. And you can see if one of these is not met, how a dysfunction could occur. A dysfunction could occur very early in the physical substance. Maybe that parent isn't able to, doesn't have the physical means to take care of a child, doesn't have the financial means, doesn't have food, shelter, clothing, maybe live in a homeless shelter. Maybe they're not able to give them that emotional support that they need. So you can see where there could be breakdowns in that family function also that we have to be aware of and kind of learn, how we deal with that. And the family as a social unit, the family structure can be all kinds of different things. So you can look here and just look at how many different social units that we can have. It doesn't have to be the traditional mom, dad, and children. So we're in the society that we live in today, we have all kinds of different types of what we call families, and is that social unit. So we need to integrate that into part of our teaching and educate parents and educate people on the different types of people and how we all cohabitate together in the society that we live in. So what are some things that can affect, like childbearing, child rearing, things of that nature? So you think about family size. The smaller the family, the more attention the children get. So if you have a mom, a significant other, dad, or a social unit, and there's just a small number, that child's going to get a whole lot more attention than if they have 5 children. They're going to get different kinds of things. So that's going to change the dynamics of that family. Sibling order and gender. If you get, usually if you have 3 children or more, the first child, typically the parents have to spend more time with that child because they don't have any other children to spend time with. The expectations are usually higher for that firstborn, and then they actually decrease as the child goes further on. So the birth order does kind of make a difference. Gender. If you have a family of 4 boys and you have 1 girl, that little girl's probably going to be have more male tendencies because that's all she's grown up around. Or you have a male that has grown up in a family of all females. Or you have a child that's grown up with adults all their life and they don't have that social skill to play with other children. So all of that does make a difference. Parental behavior, how the parents behave around the children. How do they interact with those children? Divorce. A lot of times, we have a really high divorce rate in our country. And unfortunately, the children sometimes suffer with this. So think about, the kids that maybe think it's their fault and they have that internal feeling of guilt or what did I do wrong? And then culture. So making sure that we as nurses are culturally competent. What that means in just general terms is if you're working in the OB unit and you have a mom that comes in and her specific culture does not allow a male provider to take care of that patient. Well, finding that out up front and then integrating that into her birth plan. That is cultural competency. We've done something to make sure that happened for that particular patient. So that's integrating something into our practice as nurses that makes that better for your patients. That's cultural competence. So we kind of talked about in the last chapter about the shift from the hospital to the community. Hospitals are so expensive, and all of the resources that we use in the hospital are so expensive that if we can decrease some of that and get them into the community, it's more cost effective. So we think about, we're starting to get more community-based healthcare centers. So you think about the urgent cares, you think about the health departments, you think about all these different places, and what their emphasis is on, they kind of emphasize wellness. So we want to keep people well because it's more expensive when they get sick. So if we can do health promotion, teach them to keep themselves healthy, there will be less likelihood that they will use those costly services. So example of pregnancy, if a mom gets pregnant and she doesn't do the prenatal care, there's a chance that that baby might have more complications because mom didn't know what she was doing was wrong, or she didn't have the proper nutrition. She wasn't taking the vitamins like she needed to. So all that makes a difference. So putting that into play and making sure that we get that health care out to those patients. All that's going to be really important in making sure that's happening. So if we think about our community-based nursing, we're going to focus on prevention, which that's what we've talked about in our fundamentals class at a couple times. It's directed toward individuals and families in the community itself, where care is going to be delivered outside that hospital setting. So the hospital needs to be for those people who are very sick, who cannot be taken care of in the community, which means that we don't want to, overuse our hospital setting. We need to be back in our traditional settings, using our primary care doctors, using our health-based centers, using our clinics. We now have clinics in the school system, so the children need to be going there, to use the health care that has been provided. So the goals, one is to meet that, Healthy People 2020, but it's to help people meet their health care needs and to continue that through their lifespan. So we've talked before about primary, secondary, and tertiary prevention. Primary prevention is promoting health, preventing disease. So promoting health is going to start in our schools. We're going to teach them about, bullying, drugs, safe sexual practices, abstinence, all that kind of stuff. Vaccines, all of that is primary prevention, preventing people from getting sick. Secondary prevention is where, we have screening things set up. So we're going to screen for hypercholesterolemia today. We're going to screen for high blood pressure. You go to Walmart and they've got the person out there screening for blood pressures. They're screening for glaucoma. They're screening for scoliosis. At the school system, we screen eyes. We screen ear, hearing, to make sure we're catching any of those things that go up. The kids are going to the doctor every year if they're in sports, making sure that they don't have a congenital abnormality that we've never caught before. So those are all secondary prevention. We're going to catch it early so it can be treated and they won't have those complications later on. Tertiary prevention is where, kind of focuses more on rehabilitation. So now we know a child has an illness. Maybe they have asthma. And now we want to keep that asthma at bay so they don't become sicker and end up hospitalized more and more and more. So we're going to have to teach them what things do I need to stay away from? How do I need to take my inhalers? Which inhalers do I need to take? How do I take those inhalers? What's the best way? So there's all these different kinds of things that we need to be teaching, and that's tertiary, preventing them from getting sicker than what they are. So thinking back to maternity again, if you're thinking about maternity, we got prenatal and postpartum home care. So like if you got a mom who's really sick, they might be having a home care nurse go out to the home and talk to that mom about prenatal care. Maybe if she's got some postpartum problems, we got home care going out to her home, checking for DVTs, making sure that, baby's stable, making sure mom is stable, and we provide those services outside the hospital setting. So now switching gears, think about where is babies born? Well, most everybody's like, oh, they're born in the hospital. Well, 9 times out of 10, they are born in the hospital. However, there are other places that are starting to come back to life again that we have to educate you guys on so you're prepared when you go out into the workforce. So home deliveries are becoming a little bit more common. Usually you have a certified midwife or a midwife that's going to do that. They have further education. They're usually an RN, and they have further education to become a midwife. They do not do C-sections. They do not care for moms who are high risk. They are very low risk deliveries, and they're going to be done at home, but only for low risk deliveries. If mom has hypertension, diabetes, any congenital heart disease, anything like that, they are not going to be a candidate for a home delivery. Birthing centers. Birthing centers are also for low risk births. We don't really have any birthing centers kind of around here, but in the cities they do, and they're it's kind of like a surgery center, only we call them birthing centers now. So it's a freestanding building where the mom comes in, she does all her prenatal care there, all of her childbirth classes are there, everything that she needs to do is right there in that one building. And then she comes in, she delivers there, she labors there, she does her postpartum there, all the well baby checks go back to the same place. And so they're all in one place, which makes it a little bit easier for parents to do that. But again, these are only for low risk births. They only do certain activities. If mom is high risk, she's going to have to go to the hospital because they have to have more invasive, more treatments, more things like that to be able to care for them. So then the last one would be the hospital, which in our community, that's where most people are going to go. And now we do have family center birthing centers, family centered. So when you come into a lot of the birthing centers here, many times you will labor and deliver in the same room, and then mom and baby will both transfer over to postpartum. Some hospitals are able to labor, delivery, and postpartum there, but it depends on the capacity. It depends on how big the hospital is. In our region here, we will labor and delivery in one spot, and then they will get transferred over to postpartum. So, and baby will go with mom as long as the baby is stable. Community settings for kids. We're not going to go a whole lot into this, but I just want you to be aware that there's a lot of other community settings for kids where they can get treatment also for any type of congenital or acquired diseases that they might have. So again, we always go back to that nursing process, but it's an ongoing process. What do you think about communication? Communication is going to be one of the biggest, most fundamental things that you can do in your career as a nurse. You have to learn to talk to your patient. You have to learn to know what they need and what they don't need, what they want and what they don't want, what their culture is and what their expectations are, what is their birthing plan, and we have to meet that birthing plan. And then education. There is so much that you have to educate a new mother on, and we have 24 hours to 48 hours to do that. And it is a large amount of information. So a lot of times we send them home with books, and that's part of the reason we have them do prenatal care, is because every time they go to the doctor, they're going to be educating them for that whole 9 months leading up to that delivery. So when delivery comes, they've talked to them about how to care for your newborn, how to change a diaper, what do I need to do if they cry a lot, how do I need to put them in their cribs. All those types of things are going to be provided. And then all the services outside, WIC, the health departments, home health nurses that can come out to the home, all that's going to be very important. So as you as a nurse, your advocacy for these patients is going to be critical. Sometimes your babies can't speak out for themselves. So when we see something that needs to be done, we need to advocate for that patient. Because sometimes it's not that the doctors don't want to do it or somebody doesn't want to do it. Sometimes they don't know where to go. They don't know who to reach out to. So, make it your job to find out, who do I need to reach out to get this family what they need? How do I get them referred? How do I get their transportation needs? Do they have a public transit? Do they have a bus? Do they have, in the cities there might be subways. How do I coordinate their care? Do they have a telephone? Do they have a cell phone? If they don't, how am I going to get that information to them? And then make sure that they're repeating all that back to you so they understand what you're trying to tell them. So as far as like the things that we're going to look at as far as community-based nursing, as far as our aspects of it, we need to know what resources are available, what cultural influences are in our area, what cultures are we going to be dealing with. In our area alone, we have SIU, which does bring a lot of different cultures to our area. So that's something that we need to be aware of when a patient comes in, and kind of know a little bit about their culture and how do I integrate that culture and become culturally competent when that patient comes in. We have to be unbiased and not, deliver our opinions. Remain neutral during data collection, especially if your patient tells you something that could be a little shocking. Remain neutral and just, be very forthcoming and, not go, oh, really? Listen and always, remain neutral in that. Become very holistic, where we don't just look at, oh, mom's coming in for delivery. Let's look at mom's whole picture. Where does mom live? Where did mom come from? Is she going to be able to take care of this baby? Is she providing that baby with the bonding that it needs? So you'll be watching the bonding of the babies with their moms. Is mom bonding with the baby, or is mom, very standoffish with the baby? So we're going to look for all those kinds of things. We're going to focus on wellness. not on illness. We don't want them to get sick. We want them to stay healthy. So we're going to teach that mom. The first 4 weeks, keep them out of, especially in the wintertime, don't take them out to Walmart. They don't need to be going to Christmas parties. They need to be home and, protected. Be careful going to daycare. Keep them away from people who are sick. All those kinds of common things that we need to be teaching them. You guys have all seen those babies that look like they still have their wristbands on from the hospital at Walmart, and it's 0 degrees outside and everybody's coughing and sneezing. Those babies need to be at home. So that's education that we need to provide for them, and make sure that we're advocating for those patients. And that's it. That is chapter 2.